You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Joe Souza. Joe is a certified trichologist. Trichology is the study of hair and scalp. He is here today to discuss a state-of-the-art new cold laser that potentially could stop hair loss and in some cases increase hair density. Mr. Souza, welcome to the program.
Please, Joe.
Okay.
Thank you very much. Joe. It's great to be here, Randy.
Good. Now, your position with Hair Solutions is what?
Well, I'm basically the company trichologist for the company on a national level. And what that means is being the person in the company with the highest level of knowledge about the technology and hair loss. I go to each clinic that's opening and getting started and train the staff on who this is going to be best utilized for, who it's not going to work for, and how to actually use the equipment.
Okay, what is trichology?
Trichology is the study of hair and scalp.
We're talking about this cold laser today. That's why we've invited you on the show.
Correct.
You use the technology on your own head.
I did. I actually started with Hair Solutions in New York City as a client.
Okay.
I'd been losing my hair since I was 19. I'm 40 now. And I had tried everything under the sun. And
everything like what?
Propecia, which I can't take.
Okay.
Various hair products, from shampoos to vibrating brushes to DHT blockers that you take orally, and nothing ever really worked.
So were you skeptical at first about this laser?
Well, sure. I mean, after you've been through the gamut of treatments and nothing works, anybody would be skeptical.
You brought a photo.
I did.
And I think that'll add a lot of credibility here. What are we looking at here? This is your...
That's my photo. This is what I looked like before I started.
This is your before.
That's correct. And right next to it is what I looked like after about 7 months of therapy.
So is this typical? This is dramatic.
It is very dramatic. Some people don't get as dramatic result as others.
Okay.
Everybody responds a little bit differently to the therapy. As a guideline, the more further you are in your progression of hair loss, the less of a result you'll actually get. The ideal person to go through this therapy is someone who's in the early stages of male pattern thinning or female pattern thinning.
Now, we're going to have a few medical doctors on the show to talk about the technology. And we'll start with you, an expert on hair. How does it work?
Well, I think the first thing that people need to understand is how DHT works. Now, if you've heard any hair loss commercial, you've heard about this thing called DHT.
Yeah, what is DHT?
Basically what it is, it's a byproduct. And what happens is, as a man, your body produces testosterone, which is a hormone that creates all of your secondary male characteristics.
Okay.
If you don't use all the testosterone that your body creates, you get leftovers.
Okay.
Most men also create an enzyme called 5-alpha reductase. This enzyme and that leftover testosterone cell are attracted to each other. When they merge, when they hook up, they become a much more potent hormone called dihydrotestosterone, or DHT.
Okay.
Your hair grows in 3 phases. Okay, like baby teeth, your hair grows in, falls out, and replaces itself. Okay, your growing phase is genetically coded to last anywhere from 2 months to 7 years. Someone, for example, who can grow their hair to their ankles happens to have a really long growing phase. That's just the way their body is created.
Okay.
Someone who has a shorter growing phase may not cut their hair for 20 years, but it's not going to grow past their shoulders. Okay? The first problem with DHT is it changes the genetic code of that hair follicle, and it shortens the growing phase. So when a young person starts experiencing hair loss, the first thing they notice is there's more hair on the pillow. There's more hair in their hand when they wash their hair, because the hair cycle is recurring more and more often. There's nothing anybody can really do about that. The second thing that happens is the hair follicle becomes inflamed. So when the hair falls out during its normal course of its cycle, the follicle shrinks a little, and the new hair grows in skinnier than the previous hair. Okay. So now you got 2 things going on. You've got the hair cycling more often, and they're getting skinnier and skinnier and skinnier as time goes on, until the follicle closes completely, skin grows over the top, and the follicle is gone for good. Eventually it just
So
dies.
the hole that the hair comes out of closes up because of this DHT. Now, some of these other, for example, when I think of products like Propecia, similar, I mean, does it work on the action of this DHT? What is it?
Well, what it does is that enzyme that we talked about is created in the prostate. Okay, Propecia actually eliminates or takes down the amount of that enzyme that your body produces.
Okay.
So there's one component of that DHT that's not being produced, so your body can't produce DHT.
So how does this work differently, or more
Well,
effectively, I should say?
I can't say that it's more effective because each of those things has their own place.
Okay.
And different people respond to different types of therapies, including combination therapies.
Okay.
This product, this laser, increases microcirculation in the surface of the skin. Okay. What that does is that works primarily as an anti-inflammatory. So that swelling that's around the hair follicle goes away. So the follicle can relax and open close to or back to its original size. So now, when the hair regrows after it falls out, it's going to start coming back thicker than the previous hair. And sometimes we'll sprout a second or third hair out of the same follicle.
Now, this cold laser, no burning,
No burning,
side
it
effects.
can't burn your tissue, change your eyesight, shrink a cancer tumor. Those are a completely opposite end of the spectrum as far as lasers go. There is no thermal component in this laser. You can touch it, feel it. It will not burn your tissue, cut you.
Okay, let's take a look at some of the results, and
Okay.
we're going to take a quick break, bring on the medical doctors, and
Okay.
hear their views and
Great.
opinions. So what are we looking at?
Well, you're looking at a series of pictures of some of our clients out of the New York office. Okay, this gentleman had a very large area on the vertex, which is the back of the head, that was covered with peach fuzz. Now, the standard in this is if you're shiny bald, you're
Right.
probably not going to get the best result. Okay, but if the follicles are still viable and able to produce some form of hair, then we can usually get a positive result. And you can see that this area nearly closed completely, because it took that peach fuzz and turned that peach fuzz back into real
So
hair.
the peach fuzz becomes thicker
Correct.
because you're reducing the inflammation on the scalp.
And the
to let
follicle is becoming larger.
Okay.
Also, the follicle is being fed by blood, okay, more than it was before because of the decrease in the size of the hair follicle. So that once the follicle starts to function properly, it re-adds the pigment to your hair. Peach fuzz, as a general rule, doesn't have pigment. It's white, wispy, lifeless hair.
Okay.
But once the follicle starts functioning correctly and creating good hair, the hair comes back alive. Let me show you another example. This gentleman, again, the same area, the vertex, very large, thin area, almost completely closed up. This gentleman, this is a really good example of how the hair shafts become thicker.
How long does it take to get those kind of results?
People start to see visible results anywhere between 4 and 12 months.
Like this guy right here.
Okay, this is actually a 6-month result.
Okay.
And if you notice in the before picture, the hairs at the ends are very shaggy.
Okay.
There's not much of a definitive hairline. But after he went through the therapy and the hairs got thicker, the hairline actually became much stronger.
Okay. Now let's go over here to this guy.
Okay.
So this particular guy tried minoxidil, Propecia, things like that?
This is a 48-year-old guy who had pretty much tried everything. You know, he's still single. He wanted to feel better about himself, to be able to go out on more dates. He came in to see us. We knew that we could help him. And
Now this is a huge result.
it's a
this
huge
particular
result.
guy.
It's a huge result, yes.
And again, you see this every day.
We do, every day.
Now you're collecting more and more data, obviously. You've done over 4,000 clients now?
I would say it's probably in excess of that, yes, nationwide.
And the results are continuing to get better.
Absolutely. And the more we learn about this technology, the better the result is.
What does the FDA have to say about this cold laser? Safe?
The FDA has deemed it safe. It is cleared for safety for cosmetic use.
Okay.
And the FDA has classified it as a Class 3A cosmetic laser.
Now you're you're about to submit paperwork to the FDA.
That's correct. There have been other studies that show that this laser has increased blood flow as much as 54% in certain individuals. And what we want the FDA to do now is to make an announcement that this really does work, it stops hair loss, and it regrows hair.
Okay. Now, anticipating this interview, talk to the president of the company, Steve Tucker. He says 80% or more success rate.
That's
with this.
correct.
Is that
80%, 80 to 85% of our clients stop the progression of hair loss. 75%
doesn't get any worse?
Correct. It stops shedding. And one of the doctors you're going to talk to today
Okay.
is actually someone who's experienced that for himself. Randy, you seem like one of the kind of guys who would come into my office as a non-believer, let's say.
Right.
Okay.
Very skeptical.
Okay. Let's talk about a few more of these clients. Okay.
Sure.
There was incredible potential on the top of his head for hair growth.
Okay.
He got a phenomenal result.
Who's a perfect candidate for this? Ideal candidate.
Ideal candidate, 25-year-old guy, notices hair in his hands, doesn't notice visibly that he's losing hair.
Right.
Because the average person...
Just starting to come out.
Right. A person has to lose 25% of their hair in an area before you notice that it's actually thinning. Okay, so the ideal person is someone who hasn't quite gotten to that point.
So earlier treatment rather than
It's
later.
like anything else. You're more likely to treat something and cure something if you catch it early enough.
Okay, but you're convinced, I mean, in most cases, that you're going to, that means they won't, I mean, if you catch them early enough, they're not going to lose any more.
That's correct.
It's going to keep the hair that they have.
We can stop time.
Joe, I want to thank you for coming on the show today, and we are out of time. So where does somebody go first?
Well, the first thing you need to do is check out the website. Get some basic information and go and see one of our specialists in an area near you. And we can tell you exactly how we help. Right now, Hair Solutions has the technology to help you if you have a thinning hair problem.
Okay, and it works.
It works. And I'm walking proof that it works.
Okay, now, from talking to the medical doctors today and talking to you, none of this is an overstatement. I mean, you see results every week.
I see it every day. I travel the country and help them open new centers, and I see this every single day. And as much as I believe in this, every day it amazes me more and more and more.
80% success rate.
80% success rate.
More than that, maybe?
More than that, yeah.
I mean, in your hands,
at least
you've
for
seen
stopping
better?
at least for stopping the hair loss, sure.
Okay, great. So more than 80% to stop it.
Correct.
Okay, good. I want to thank you for coming on the program. Very
Thank you.
interesting.
I've been losing my hair for at least a couple of years, at least. I cannot exactly recall, maybe even longer. It's been thinning, but lately, the last year or two, it's been very noticeable. I heard about Hair Solutions from a close friend of mine, and what made me decide to call, it was just a very easy process, very natural, very low-grade laser, you know, no surgery involved, so just sounded good. And I called, and it was just very easy. Well, I was a little skeptical because I didn't know that much about it yet. And after I spoke to the representative, and she just ran through the whole process with me, and it just made me more comfortable, and I just decided right there on the spot to give it a try. I've been receiving the treatments for about 4.5 months now. I'm very happy. I'm extremely happy. There's a huge difference. I'm more confident. Let's say for lunch, this is the biggest thing I always tell everybody. Usually when I ate at lunch and I would sit down and friends of mine or people I work with would pass by over my head, that would just make me feel kind of, you know, they're looking at my thinning bald spot, you know. And now I don't have that anymore. So it definitely does boost your self-confidence, and, you know, I just feel better. Well, there was a couple of points actually. I saw my head, the top of my head in a mirror actually, using another mirror, and I was like, oh my God. And then a girl I work with, she told me at some point, I don't remember what we were discussing, but she was like, you know what, I can't really tell that you're losing your hair when you're coming, but when you're going, that's when I can really tell. Yeah, I used to wear baseball hats just to cover up my bald spots and go and buy different hats. So basically, that was the main reason to cover them up. I'm not a big, you know, baseball cap fan. I don't wear them anymore. I'm done. I would absolutely recommend Hair Solutions to my friends because there are two reasons. The main reason, of course, growing hair. The second reason is my hair have gotten much healthier. And I remember when I used to read a newspaper or a book, I would play with my hair and I would just see them fall. A dozen, I don't know, 15, 20, 30, depending on how long. Now I can just run my hand through my hair and pull it, and, you know, there is nothing. And it's just, it's very natural. There is no surgery involved, non-invasive, and, you know, no side effects except one big side effect. You grow hair on your head, you know.